Good morning. It is Tuesday, March 17th. Happy St. Patrick's Day to all of you folks who celebrate this Irish festival. The festivities, unfortunately, because of the COVID-19 virus, a lot of our partying and celebration has been shut down, especially for Houston County. I know there's a lot of family friends in Humphreys County, but wanted to do this video, give you an update what's going on here in the state of Tennessee. Last night on the House floor, we met in a briefing from medical professionals. I will share that in this video. What I'm looking at is my computer screen talking about the COVID-19 update since yesterday. Coming from the Tennessee Department of Health, we have a case count of 52. Campbell County 1, Davidson County 25, Hamilton County 1, Jefferson County 1, Knox County 1, let's see, Rutherford County 1, Sevier County 1, Shelby County 2, Sullivan County 1, Williamson County 18. So the biggest part of the COVID-19 that is being discovered here in Tennessee is right here in Middle Tennessee. For public information, the public information line phone number is 877-857-2945. 877-857-2945. Tennessee Department of Health website, www.tn.gov/health, H-E-A-L-T-H, health. And now let's get into the video that was filmed last night on the House floor. The question and answer periods shortly after we began last night. President Trump came out with a social distancing of keeping that 3 to 6 foot space around you, but limiting the size of 10 people. Here in the state of Tennessee, we have 99 House members. So we broke the conversation up into two different groups, even and odd number counties. I was House District 74, so even numbers. We started at 4 o'clock. At 4:30, the odd number members came to the House floor. The current status here at the Cordell Hull building is the interns were sent home. Lobbyists are not allowed in the building. Media was here yesterday for conversation. Those members, staff with infirmities, they just were allowed to go home and not be in the building, really in shutdown mode, even in the Capitol. Secretary of State came out closing down the museum, the State Museum and the State Library. Going to be some trying times. We just need to be patient with everyone. And today we're meeting at 9 o'clock on the House floor, having session. Conversation is, and per Tennessee Constitution, our main mission is to pass the state's budget. So we're feverishly working on the state's budget. Hopefully we can come to an agreement, leave here on Saturday, take a recess for a couple weeks, but not sure of that date. It may be longer than 2 weeks. But hopefully stand by and we'll see what's going to happen.
Dr. Jones is first, so let's give Dr. Jones a welcome.
Well, good afternoon. I'm certainly very happy and privileged to be here. My name is Chris Jones. I'm a cardiologist and chief of staff at Centennial Medical Center. I'm accompanied today by Dr. Jonathan Perlin, one of our nation's most renowned physician leaders and the current chief medical officer of HCA. And also Mrs. Heather Rohan, registered nurse and now CEO and president of the 19 hospitals in the TriStar division of HCA. Also here today from Vanderbilt is a world-renowned infectious disease specialist, Dr. Bill Schaffner. We're very happy that he could accompany us as well. We plan to keep our comments brief as we are concerned about the size of this group, and we want to follow the CDC guidelines as closely as possible. Like you, we love this country and we love Tennessee. We want to help keep you safe. Your constituents need you to be physically able to pass the laws that helps Tennessee, and you can't do that if you're sick or worse. Mrs. Rohan had the opportunity to walk through the state capitol and the Cordell Hull building over the weekend and give some guidance to already start some implementation of ideas prior to even today. President Trump has declared a national emergency. He did this past Friday, and he added that the next 8 weeks are critical. Governor Lee has also declared a state emergency. When emergencies occur, our normal operating procedures change, and we act in new ways, decisively and strongly. Newt Gingrich wrote on Saturday, we should be planning for a worst-case pandemic and using the kind of intensity of implementation which served us so well in World War II. Thankfully, we have the advantage of seeing what happens in other countries so that we can guide our own actions. A delayed response like that of Italy will lead to the same healthcare resource depletion. Some hospitals in Italy have been forced into terrible scenarios, like deciding that only younger patients will be placed on breathing machines. Or we can follow the better example of countries like South Korea, where early recognition of the problem and institution of measures such as social distancing have led to continued normalcy of healthcare operations. I've heard some comments from concerned citizens that I'd like to address. Number one, there aren't many cases yet. It's not that bad. We've all seen news coverage prior to a hurricane landing. The sun is often out and the seas are calm. There always seems to be a few people, though, who don't heed the advice of the weather scientists. We usually see those people on TV and shake our heads because we know what is coming. We trust the experts that a monster storm is headed their way. This virus is a similar scenario. There aren't many cases yet, but when it arrives, it will hit hard and fast, like a hurricane. Number two, how long will this last? Let's close down for 2 weeks, and then we'll be okay. President Trump stated that the next 8 weeks are critical, and his estimate is likely a good one. We shouldn't expect this virus pandemic to pass through Tennessee in just 2 weeks' time. Number three, this doesn't affect me, it only affects the elderly. In South Korea, where testing is performed, the highest percentage of cases appear to be in the 20 to 40-year-olds. They usually have mild symptoms and recover, but not before, on average, infecting 2 to 3 more people, some of whom are vulnerable and develop severe illness or death. One last point, the fatality rate starts to dramatically increase in people 60 and older. I usually don't think of 60 to 70 as being that elderly. Sean Hannity said on Friday night, federal and state governments, private businesses, and top hospitals are coming together to stop the coronavirus to protect the health and well-being of the American family and to keep Americans safe and get our economy back on track. We agree that it will take all Americans recognizing and cooperating in this fight against the COVID virus scourge. I'm going to conclude with that, and I'm going to ask Dr. Perlin to come up and make his comments. Thank you.
Thank you, Dr. Jones, and good afternoon. Dr. John Perlin, President of Clinical Services and Chief Medical Officer for HCA Healthcare. Had the privilege of being here in Nashville for about 13 years, having previously served as the CEO of the Veterans Health Administration and the Veterans Healthcare System. And as Undersecretary and in prior roles, I provided clinical leadership for our nation's response to 9/11. With that as background, I thought I'd offer a few quick comments in 4 areas and respond to any questions you might have. So those 4 areas are really a framing perspective from managing large issues, crises at scale, some of the preparation we're doing in HCA Healthcare, what we're doing in terms of providing national support, and what you, as our legislators, might do. During my time in government, we also faced the need to prepare for a pandemic. Indeed, it was the flu pandemic, but unlike that time, this time, it's not a drill. Our own hospital data from across the country have seen rates of patients with coronavirus, now called COVID, and patients under investigation roughly doubling every day for the last week. And our colleagues in the insurance industry with national footprints are reporting to us an increase of 33% daily in COVID cases. And clearly, these rates will continue to increase and accelerate even faster as lab testing becomes more broadly available. One of my most favorite colleagues in Washington, Governor Mike Leavitt, in his role at the time as Secretary of Health and Human Services, said the following in 2007. Everything we do before a pandemic will seem alarmist. Everything we do after a pandemic will seem inadequate. This is the dilemma we face, but it should not stop us from doing what we can to prepare. We need to reach out to everyone with words that inform but not inflame. We need to encourage everyone to prepare, but not to panic. So let me share with you what we're doing to prepare. At HCA Healthcare, we always think about people, process, and technology. First, with respect to people, preparation begins with education. In the absence of understanding, people see dragons and fill in the blanks with their own fears. And this is scary stuff. So we've been seeking to educate our clinical colleagues on COVID and how to protect themselves, fellow staff, and of course, and most importantly, the patients. Assuring safety also requires both personal protective equipment, including items that are known to be in short supply, such as masks, but it also requires environmental controls, including segregating patients with symptoms suggestive of COVID from patients in need of all other routine healthcare services that they come to us for each and every day. We're thinking constantly about surge capacity. Our concern is much less about space. We can turn spaces that are used for more elective activities into additional clinical staffs. We're much more concerned about staffing. As schools close, clinicians who are parents will be torn between working and caring for their children. So our focus is not just on preparing space, obtaining equipment like ventilators and assuring supplies like masks, but on making sure our caregivers are prepared for the worst, even as we hope for the best. In terms of national support, HCA Healthcare provides services in 45 domestic markets, and of course, our home is right here in Middle Tennessee. By virtue of our national footprint and the privilege of 35 million patient encounters at 2,200 sites, including 185 hospitals and over 300 freestanding urgent care centers and emergency departments across the country, we've committed to sharing surveillance data with our Centers for Disease Control, the CDC, and other parts of HHS. Our CEO, Sam Hazen, is on the White House Task Force, where he provides valuable insights from both healthcare as well as from the perspective of a Fortune 60 corporation. And I have the privilege of being on the governor's COVID task force. Please know that we are committed to our patients, to our country, and to the great state of Tennessee. So what can you do as legislators? First and foremost, I believe that Governor Leavitt had it right. Everything that we do before a pandemic will seem alarmist. Everything we do after a pandemic will seem inadequate. We need to encourage everyone to prepare, but not to panic, and we need you to help set that tone. More practically, if our kids are home from school and our caregivers are torn between work and childcare, we need to relieve their burden. We need your help in convening religious organizations and other organizations to provide small group childcare for healthcare workers. We understand that in Washington State, the governor is now reviewing a proposal to put school teachers back to work providing small group childcare. During my time in Tennessee, I've learned what being in the volunteer state really means. We not only rise to the challenges, but we create opportunities. I'd ask whether you all think that there are ways that we can turn our production capacity to things like surgical masks that are in short supply worldwide. In closing, let me turn back to the words of Governor Leavitt. Pandemics happen. They're a fact of life, a fact of biology, and testament to history. Viruses are constantly mutating, adapting, and attacking. Any community that fails to prepare with the expectation that the federal government can come to the rescue will be tragically wrong. I know that's not the Tennessee way, so in closing, I'd offer this. I'd rather regret over-preparing than be remembered for under-preparing. With that, I want to thank each of you for your service to our state and our citizens, and I'd be delighted to join my colleagues, my terrific colleagues, in answering any questions at the end. Thank you so very much for what you do. My pleasure to introduce Dr. William Schaffner.
Good day, everyone. I'm Dr. Bill Schaffner. I'm an infectious diseases physician at Vanderbilt, and I work closely in public health, including with my colleagues at the Tennessee Department of Health. It's a privilege here to be with you. I can but really echo and perhaps emphasize the comments of my colleagues. They've really given you the essence. This is a new virus in our community and across the United States and indeed around the world. Everyone, when this virus became evident, everyone on the globe was susceptible to this virus. No one had seen it before. It's a virus that's very easily transmissible, and the way it's transmitted is most efficiently is by close personal contact within 3 to 6 feet. The virus is in my lungs. I exhale. Microscopically, that virus is in the air that I exhale. And if you're within 3 feet of me, you will inhale some of what I exhaled, and the viruses will travel along and may indeed infect you. It's highly transmissible. We don't have a vaccine. We don't have a therapeutic antiviral yet. And so what we do in order to prevent the transmission of this virus, I should say perhaps reduce the transmission of this virus, is old-fashioned public health. You've heard it mentioned many times, social distancing. If the virus is transmitted when we're close, then we want to be far away. And we do this in a variety of ways by not attending and indeed closing down large venues where large numbers of people gather together. And then we also do this in many different ways in our business and professional associations. And you're doing that now, and my compliments to all of you. Privately, individuals are trying to figure out how to do that in their own lives. How do you actually change things in the home such that you also, on a personal level, within the family and your relationships outside, also come into less direct contact with people around you? We trust that this will be temporary, but as Dr. Perlin said, we don't know for how long this will last. We'll keep you informed as we find out more about this virus and how it's spread in the United States. We ought to make a comment about testing. Testing is very important. It's rolling out as we speak across the country. It still is not where we would like it, but it will give us a better sense of how widely distributed this virus is and whether there are so-called hotspots across the country and how transmission is continuing. We're in the middle of that process right here in Tennessee. I think I would like to say just perhaps in closing that we're happy to take your questions. We understand that you may have many, and we're happy to try to answer your questions. Thank you very much. Sir.
Are all distributed. Are we only testing people? Oh, I'm sorry, I didn't know it was working. When we start testing, are we only going to test anyone who asks, or is it really meant for those who display symptoms?
Yes. At the moment, testing resources all across the country are somewhat limited. So the focus will be indeed on people who are symptomatic, and the person who's assessing those individuals will make an independent medical assessment about how likely it is that they had coronavirus. I think there will be an emphasis on older persons because although they're not more likely to get infected, when they do get infected, they're more likely to have severe disease. And in addition to that group, anyone who has a notable underlying medical condition, a chronic medical condition such as heart disease, lung disease, diabetes, and who might be immunocompromised. So we're going to focus the attention on those patients who need that information most important clinically and to meet the public health objective of diminishing the impact on hospitalizations and deaths.
Thank you, Speaker. Thank you all for coming. Just a quick rundown for the simpletons like me. Could you share with us so we communicate with our districts about what the early symptoms look like and how they develop over time, please?
So one of the devastating things about this virus, one of the subtle things about this virus, is that it mimics in the early symptoms a common cold and then those of influenza. I'm supposed to be a sophisticated infectious disease doc, but if I have one patient with coronavirus disease and another patient with influenza standing in front of me, and they both tell me their symptoms, I can't tell them apart because they're very, very similar. Sore throat, quickly a dry cough because of the bronchitis that occurs, and then the inflammatory response in the body will create fever, feeling poorly, and just feeling punk. On the more severe end of the scale, if this virus leaves the bronchi, the bronchial tubes, and gets out into the substance of the lung, it can cause pneumonia, the most common and most ominous complication, and that can result in breathing difficulties.
Thank you all for being here. You alluded to the testing and working to isolate those that are positive. Are you finding, and this is just anecdotal situations coming from my county, the Department of Health is doing a terrific job in the containment and the education, but is there a partnership coming on board with the professional medical community to meet the need and to partner and to kind of graft into the public health? What can we do to remove barriers to make sure that in the space of public health that the clinicians are also coming on board? Because when someone drives through a testing facility and 10 or 15 minutes later they are positive, it's going to be a clinician that somehow isolates them and moves them into a treatment pathway and not someone in the health department providing education. So kind of walk us through your setup on how the health departments are partnering with our clinical community. Thank you.
Thank you. There are a couple of really great examples of that happening. This is a time that my name is Heather Rohan, and I work for TriStar HCA. I'm a registered nurse. There are a couple of great examples of collaboration between healthcare systems that are occurring as we speak. First of all, the Tennessee Hospital Association, which has hospital members throughout the state, is cooperating, collaborating with the departments of health in their respective areas together to, again, make sure that we're approaching things in a similar fashion, that we've got routine protocols and those types of things. So that's one collaboration that's taking place. I know that in Chattanooga, there is also great collaboration between those three health systems there in working with their health department. This is a time when we come together, and here in Davidson County, we left a press conference just about an hour ago that had the collaborative effort that is occurring in Davidson County, and that has all healthcare systems involved in it, the Red Cross, the State Department of Health, the local Department of Health, the mayor's office, and others. So I think what you're going to see and what you're seeing across our state is everyone, a call to action for all of us as healthcare providers to coordinate our efforts to the best extent possible that will, again, coincide with the work that the governor's task force is doing, as well as other things there. So this will be a time you're going to see, again, cooperation across the continuum.
We have like 8 minutes, so if we could do a rapid fire. I've got everybody, but let's just say that let's try to get through. There's like 6 more people.
Thank you, Mr. Speaker. Can you talk to, we hear this a lot, about the susceptibility of this virus to heat and breaking it down. Is that true, false? What can you talk about on that?
I think you probably have reference to the fact that this is a respiratory virus, and there is the anticipation, or perhaps I would say the hope, that like other respiratory viruses, such as influenza, once the weather gets warmer, this outbreak will abate and will go down. Well, we can hope that that's true, but please remember that this is a respiratory virus that's new to humans, and as I like to quip, I'm not sure it's read the textbook and it knows exactly what to do. So we can hope for that, but we can't count on it. We have to remain prepared to deal with this virus over the long haul.
Thank you, Mr. Speaker. From all indications, from some of the graphs I've seen, we're trending a couple of percentage ahead of Italy right now. And as the old adage goes, you can't track what you can't measure. And with our lack of testing right now, what could we as a society expect the worst case scenario to be here in Tennessee?
Do you want to talk to that? Well, the worst case scenario is one that you have to acknowledge and prepare for, but I hope it doesn't come to that. So far, actually, I would tell you something that's slightly optimistic. If this virus is out there as widely as we think, we have not yet been hit in Tennessee or really throughout the country with a surge of patients that have come to the hospitals with pneumonia, as they did in China. Now, whether that's a difference in the transmission, and we're ahead of it already, and therefore doing this social distancing will dampen that epidemic curve, or whether perhaps in general we're healthier than the population in Wuhan, China, I don't know. But I'm of the guarded optimism that we won't hit the worst end of the spectrum.
Your question on what are the worst case scenario for Tennessee is an important one, and it's the one that everyone's really focused on. The reason for the social distancing, as Dr. Schaffner alluded, is that if you don't have the distance, then the transmission is very quick, goes up high. It's really easy to see the people who are horribly sick. They're in the hospital. It's easier still, unfortunately, to see those who succumb to the disease. It's very difficult to measure who might be out in the community with low-grade symptoms or no symptoms at all. And that suggests that it may not be as lethal as in some of the other countries. But that's why in my comments I said we have to prepare for the worst and hope for the best. We can't prepare for the best and expect to really be able to meet the needs of our citizens, and the work that you're doing, the leadership you're providing by demonstrating, frankly, the ease of social distancing in this chamber itself is so very important, because that's the difference between a curve that looks very sharp and steep and high and a curve that's tempered. That's the difference between a curve that really taxes our healthcare infrastructure and a curve that our healthcare infrastructure can better manage.
So I read recently that before people meet with the president and now the governor, that they're getting their temperature taken. We're seeing temperature people taking their temperatures. They're coming into the country. Is that going to effectively keep people who are infectious from being around us? Is that a symptom immediately, or does it come up later? How comfortable do we need to be with that process?
Every public health intervention that we do is an addition that protects us. Each of them has its limitations. Taking the temperature is a good thing, because if you've got an elevated temperature, you're obviously screened out. But for periods of time after you've been infected, before you become ill, you're in what's called the incubation period. And during that period of time, you have no symptoms, and you won't have fever. So taking the temperature gets people who are already in the early stages of infection but can't catch everyone. So you do a series of things in public health in order to try to prevent transmission and, as Dr. Perlin says, mitigate the impact of the epidemic. So whether you have a temperature or not, social distancing is now the norm. I beg your pardon?
You can still transmit without a symptom.
We think that if you're without symptoms and you are infected, yes, indeed, we think you can transmit the infection. Whether that accounts for a lot of transmission or less transmission, we're not sure, but you certainly can transmit the infection even though you have no symptoms.
Thank you, Mr. Speaker. Over the past 6 weeks in my district and some of the counties that surround us, we have had cases where adults have been hospitalized with symptoms that mimic those of this virus that we're talking about today, yet they were diagnosed as some type of viral pneumonia or even adult RSV. So is it possible that perhaps this virus may have infiltrated our state? We could have already been exposed to this, and even so, maybe the nation as a whole? Or is this something that you think would be totally different in comparison to what we're seeing now?
Two things about that, if I may. First, you're exactly correct. We think that this virus is among us. We don't know how densely it is yet, how intensely it's being transmitted, and we'll be better able to define that over the course of the next week, 2 weeks, as testing gets out there. Now, the reassuring thing, the other thing that I can say is, of the tests that have been done at Vanderbilt, we have very few that are positive for the coronavirus, many more that are positive for our old friend, our old enemy, influenza and other respiratory viruses. It is, after all, the respiratory virus seasons, and those other viruses haven't disappeared. They're clearly more common than the coronavirus so far in the sample of tests that we've done.
Thank you. Can you contract this virus, coronavirus, from animals?
The original coronavirus that caused this epidemic was an animal coronavirus that jumped species, as we said. It probably was a single event that occurred in a live market in Wuhan, China, if you can imagine. All the other people who have been made sick around the world came from that one instance. So you can't acquire this virus from any other animal, sir.
All right, everybody, that's our time. Thank you all for coming. We'll be back here at 5. As you go outside, do what they say. Try to maintain that 6-foot barrier, and we'll see you back in 30 minutes.
Thank you.